Hi, I'm Marissa Ballard and I'm going to be a pharmacist today. I see here that you were recently prescribed furosemide. You may not be familiar with this name because this is the generic name, but as you can see right here, it's also known as Lasix. This medication will help you with your high blood pressure. Do you have any questions about this?
I actually do.
Did your doctor explain what side effects can occur or how you should be taking this medication?
No, not really.
Not really? Okay, so come with me and I'll give you a better explanation.
Okay, thank you.
Patients are often very confused by the names of medications. Medications have two different names, a generic name and a brand name. This can be confusing because patients don't understand that the same medication has two different names. It is a pharmacist's job to help them understand what their medications are and how they should use them, even though they have two different names.
Excuse me, miss, can you come here for a second?
Yeah.
Perfect. I noticed that you were limping. Are you okay?
I actually hurt my ankle a little while ago, but I didn't think a pharmacist can do anything to help me.
Of course, I might not be able to provide you with the proper diagnosis, but I can definitely help you aid until you get to your physician.
Wow, that's great.
Yeah, so if you could just come with me, if you have a few minutes, I can maybe get you fitted for a proper ankle brace that can provide you with some support until you make an appointment.
Many times patients are afraid to ask for help. It is up to the pharmacist to break that communication barrier and reach out to the patients to ask them if they are doing okay.
Hi Nicole, it is brought to my attention that you have recently been put on birth control for medical reasons. Is this true?
Yes.
Are you nervous about this type of medication?
Just a little because I'm not exactly sure the effects that it's going to have on my body because of things that I've heard.
Okay, that's perfectly normal. Teenagers are usually very nervous about taking any sort of hormone medication because it can mess around with your body and it can be very confusing. But one way to make sure that you don't have really bad side effects is by taking your medication at the same time every day. The best way to do that is if we sat down and consulted about your schedule and when's the best time to take your medication. I actually have an appointment for 2 p.m. for a patient counseling session. Would you be able to do that today?
Yeah.
Awesome, thank you. Sounds great.
Teenagers are often very nervous about taking any form of hormone supplements. It is due to the pressure of society and the way our society views these type of medications. It is the pharmacist's job to assure them that it is not embarrassing and that we are there for them every step of the way. Some medications require patients to take their medication at the same time every single day. The more we get to know our patients and their schedule, the better we can figure out a time that works best for them to remember to take their medication to ensure that it is being used correctly.
Hi, how are you doing today?
I'm okay, but my throat's still hurting a little bit.
It is okay. Let me look here what your doctor prescribed you. So I see here you have penicillin to treat your tonsillitis, and I have a concern about filling this prescription because only 2 weeks ago you were on a different form of antibiotics for tonsillitis as well. Do you know if you completed your medication?
No, but my throat's still hurting.
Okay, so this time when I prescribe this medication, make sure that you complete it fully because that can help with dealing with different problems.
It is very important that patients finish their medication that they are prescribed. This will ensure that they will not have a reoccurrence of the same illness that they already had before. Some patients might stop taking medication once they feel better, but in turn, this is probably hurting them in the long run. As pharmacists, it is very important to stress the importance of finishing all prescribed medications.
Hi, I'm Marissa Ballard and I'm going to be your pharmacist. Welcome to our pharmacy. I see you're a new patient here. I know sometimes it can be intimidating not knowing your medication or your current condition, but that's my job and I'm going to be here to help you through your way. I see right here that you have been prescribed for an iron supplement. I can assure you that this will help you with your fatigue so you're not as tired, and when you're doing your activities you'll have a lot more energy. Have a great day!
When patients change pharmacies, they might be very nervous about meeting a new pharmacist and getting to know them. It is our job as pharmacists to treat every patient like our own. We must greet each patient with open arms, offering them the best care that they could possibly receive. In all 5 examples, it is clear that the communication between the pharmacist and the patient is very important. We have to create good relationships with our patients to provide them with the best care they can possibly receive.